Okay, awesome. Okay, so welcome everyone, and we're so glad that you could join us this afternoon or this morning if you're joining us obviously from Northern America. We at SAMEA, we're really excited that this session is actually finally happening. We had planned to have this session as part of our workshops that happened in October. And we were not able to host this workshop, and now it's happening today. So we're very excited that it's happening, and thank you to our colleagues at UNICEF who made it possible. This is part of an ongoing relationship between UNICEF and the South African Monitoring and Evaluation Association, and in a way.
That's in Pretoria and Eastern. Earlier collision that's at the Delphi Avenue intersection is still causing delays.
Okay, and in a way, it's a continuation of a relationship that started really with our conference in 2019, emphasizing supporting the development of national evaluation capacity and the role of UNICEF. And so we're really excited that today we get to look at how UNICEF has been adapting some of the more traditional evaluation tools, which responding to COVID-19, but also in other contexts, in other emergency contexts, which is something that I think all evaluators, all development practitioners are all grappling with at this time. So it's a very, very topical issue. So we have a few presentations that we're going to go through today, as you will have seen in terms of the list of issues that we're going to try and cover. But just before we get to it, there's just two things to cover. The first thing is just please remember we are recording this session, so please mute yourself if you're not a presenter, and even for our presenters, once you're done, please mute yourself so that we don't have any interferences with the recording. For all our presenters, please just keep your video on when you're presenting, but for everybody else, you do not need to keep your video on. That just helps with everybody else's bandwidth, so we don't have anyone crashing out of the meeting. Okay, so my name is Matozia Misi, and I'm former board member of the South African Monitoring and Evaluation Association, and I'll be with you today, hosting the workshop today together with Kate and Mala, who are online helping us together with Thomas. Okay, so on that note, Thomas, I hand on to you first to start with the Mentimeter poll, and then we'll come back to Jane to say a few words.
Thank you, Matozzi. To participants, I posted a link into the chat. If you could just click on it, it will ask you 2 questions, and you just type in your question, click on submit, and we will show all the responses at the end. Thank you. Perfect. I see the answers dropping in. Please keep on filling it out. And just to get an overview, we'll also quickly share one poll question with you, and then I will give it back to Matozzi.
Okay. So would you share the results, Thomas?
Yes. Here you go. That's the responses to the first question.
That's interesting. So let's see. And I think what will be interesting will obviously be as you present to those who are going to be presenting, to see how do you talk to some of these issues that people have noted as some of the benefits of real-time exercises, and where you can also respond to some of the issues that people have identified. Great. I like the comment about unprocessed results. We'll see when the presenters talk to it, if we get unprocessed responses from real-time evaluations, real-time exercises. Okay, and then let's see the response to the poll that you did on Zoom. Okay. So as to our presenter, I mean, as you can see, not a lot of people have actually done sort of real-time, exercises, working with emergent situations. And so I think that it means that the session today will be quite beneficial to a lot of our participants. And apologies that we probably won't get a lot of time to take a lot of questions, but I think that the session will still be quite useful, and our presenters will probably can make themselves available to respond to some of the questions that you have if they're not covered today. So on that note, I'll hand over to Jane. Or Jane, do you want me to go directly to the first presentation?
Yes, I think, thank you very much, Matotsi. I think because of time, let's just move forward.
Okay, great. So the first presentation that we're going to take is from Danielle DeGarcia and Beth Plowman. They have got very extensive bios, which I will not go through because of time. But just to say, Danielle has got extensive experiences in social impact strategy and performance and learning. And so today she'll be sort of sharing some of that experience. And so will Beth Plowman, who is in the evaluation office at UNICEF headquarters, and they will be sharing their experience with approaches to adaptive management. And I think that's a question that everybody is sort of interested in. So I'm going to hand over to you and then take it from here.
All right, great. Thank you very much. Good morning. This is Beth Plowman. I'm happy to get started on this presentation. Thomas, will you be sharing the screen?
You should be able to see the screen already.
I can, but I can't control it.
Try again. Now. Are you able to click the buttons at the bottom left?
Oh, yes, now I see them. Sorry. Okay, so good morning, everyone. I just wanted to give you a very quick overview before we get started here. I mean, what we indeed would like to talk about are, an evaluative effort that was focused on learning, real-time learning, in order to respond to the COVID-19 crisis. Now, what I've asked Danielle DeGarcia to join us today. Danielle and Social Impact have been supporting us with the use of developmental evaluation, which really was directly led to or contributed to the work that we've done. So what I'm going to do is ask Danielle to spend a few minutes just doing an overview of developmental evaluation. And then I'll come in and talk a little bit about how we basically created a learning focused evaluation for the purposes of UNICEF. So with that, let me just stop and ask Danny if she'd like to proceed.
Yes, please.
Great. Shall I move the slides, Danny, or do you have control?
I don't have control yet, but either way, I'm happy to do so.
Okay.
I think we can keep going, maybe one more. And then
okay, great. Yeah.
Great. Well, thank you all. And thank you for those responses to questions. As Beth mentioned, I'm Danny. I work with a company called Social Impact that is helping to support some developmental evaluation work. So before we jump into how developmental evaluation is being applied by UNICEF, I wanted to just give a quick introduction, because developmental evaluation as an approach is still relatively new in the international kind of arena. It's been used in the private sector a little bit, but when we look at public sector and development projects, for example, it's pretty new and innovative. And so what developmental evaluation is really an ongoing, flexible and embedded approach to evaluation. And what that means in practice is that you have one or more evaluators who are working usually full-time, sometimes part-time, with the kind of implementers. And that can be of a project. It can also be internal to an organization or a process. So they are sitting there, part of meetings, etc. And because of that, as one of you mentioned, you have access to a lot more data. So it supports continuous adaptation, and that is because they are there full time, they're collecting data and then adapting how they respond accordingly. So it provides this kind of evaluative thinking and timely feedback as things change, as they evolve, and it adapts to that process. So often evaluators will start collecting data based on questions that the stakeholders come up with. And then as the needs change or the context changes or they get answers and try out a solution, they then kind of switch gears and try collecting data on a different matter to help feed that continuous adaptation. And the idea is that it's very collaborative. So in developmental evaluation, you don't necessarily create traditional reports that then, or sit on a shelf, but really you're facilitating that process from findings to then interpreting those findings to then helping stakeholders collaboratively figure out how to adapt and move. So if we go to the next slide, developmental evaluation differs a bit from kind of traditional evaluations. And that's in a few kind of main ways. So the first is around the purpose. Developmental evaluation is often not, the purpose is not accountability. It really is to support development of innovation. It's to adapt in dynamic circumstances, etc. And it's really to adapt now as opposed to focus too heavily on some kind of future project or future process. The standards are also a bit different. So one of you mentioned a challenge of how do we know when the data is good enough? And that's a valid challenge. So the standards, when you look at traditional evaluation, are talking about credibility with external actors, often independence, methodological competence, etc. With developmental evaluation, there's a much higher tolerance for ambiguity. So there has to be methodological flexibility. You don't choose your design and methods necessarily at the beginning, but rather those design and methods will adapt as your questions adapt. And so you are still absolutely collecting rigorous evidence. The data still has to abide by, good data quality, et cetera. But there's a lot more kind of adaptive thinking, ambiguity, and flexibility there. Your options also may change throughout the course of the evaluation. So you may start off thinking you are going to do a certain type of deliverable, a certain type of method, or even start with a certain type of stakeholder. And those can change over the course of the evaluation quite significantly. So you don't choose them at the outset and continue. You adapt based on needs as they evolve. And the last one is with respect to the evaluation results. So rather than traditional evaluation reports, you're really looking at real-time feedback. And so that can take a variety of forms. In some of the developmental evaluations we've done, that includes options memos and infographics. Others really prefer kind of in-person, meeting notes and discussion fora. Other times there are reports. So it really varies based on the needs and preferences of individual stakeholders, how they like to receive information, process information, and use it. So if we go to the next slide, I wanted to highlight just when it should be used and maybe what the value of it is. So at the start, if you have an untested theory of change, developmental evaluation can be really useful. And that's because if you are really in those beginning pilot stages of something and you don't know what the causal link is between your activities and the changes, You can iterate with developmental evaluation. So you can test something out, try a solution, then test the solution out. And so that allows you a lot of flexibility in adapting your process as well as implementation. Similarly, if it hasn't worked before, whatever you're doing just hasn't worked and you want that flexibility to be able to change and adapt, developmental evaluation is really useful to inform those adaptations and test out what's working and why not. If it doesn't work like it should, I think we found that then developmental evaluation is really useful. And that's particularly true in complex and dynamic situations. So conflict outbreaks, natural disasters, pandemics, when things aren't necessarily progressing as one would anticipate, developmental evaluation allows us to adapt to those changing circumstances. And similarly, when you anticipate significant changes and you expect to need to adapt and operate flexibly and kind of change your programming to different environments. So then the next slide, just to quickly talk about some of these tensions, and a couple of you mentioned these in your responses. When the first one is really making sure that you understand what decisions need to be made. And not just what decisions need to be made, but really who are the decision makers? Will the evaluators have access to those stakeholders? And are they really invested in learning? Are they able to adapt? And is it okay that somebody may not be fully external in developmental evaluation because they're with the team? Sometimes the perceptions of credibility can be difficult, even if they're fully objective. Just the fact that they are with the team so much can skew perceptions. DE also takes time and honestly budget. Because somebody needs to kind of be there and listen to different meetings, processes, absorb what's happening, you're often paying for a full-time team member, and that's can be more expensive than just sending somebody out for a couple of weeks to ask questions. It tends to be best for longer-term engagements, and the project needs to be able to adapt rapidly as well. If you're operating in an environment where decisions take, a year to be able to implement, developmental evaluation is probably not the best investment. The other one is really about the implementation structure. We want to ensure that you're able to make changes based on whatever mechanism you're using, whether that's an internal bureaucracy, whether that's external contracting or grant mechanisms, and the pieces of what that looks like. And then the last one is a really important one, and that's whether your culture is ripe for adaptation. If there are disincentives to adaptation, for example, internal power controls or performance reviews that disincentivize moving from a standard or norm, it can be really difficult to get buy-in. Similarly, the evaluator needs access to information, people, and meetings. They need to be willing to give them the time to speak with them. And often you are going to have some level of negative findings, just as with any evaluation. The difference is that the evaluator is then sitting with the team. So you need to have a team that is able and willing to kind of sit in their discomfort and take negative information and process that together. Similarly, I think the level of formality and trust is really crucial. So if you have trust, if they're willing to trust one another, that's particularly important. In addition, you really want some of that unprocessed information. So you want people who are willing to have side conversations, coffee chats, whether that's virtually or in person, that's really helpful. And the next slide. So before I hand it over to Beth, I just wanted to make sure that you all had some additional resources. Social Impact's been implementing a lot of these, and we've been learning quite a bit. So we do have some guides out there that are for either people who want to be evaluators, embedded evaluators, or people managing that process, as well as for funders. There's also a number of other links here of where you can find links to primers and interviews and case studies showing how developmental evaluation has taken different forms in different organizations and as it pertains to different processes. And with that, I'll turn it over to Beth to talk about how this has been used by UNICEF.
All right, thank you very much, Danny. Thank you. So just to give a tiny bit of background, UNICEF Evaluation Office, we were quite interested in using developmental evaluation more widely within the organization. We don't have a lot of experience with it. I mean, I'm familiar with 2 of our country offices who have used it. So we were in dialogue with social impact and really looking at creating what we were terming a resource facility for developmental evaluation. And these discussions had gone on for a while, up through about February, early March of last year, when basically, COVID changed just about everything. And what we did basically was we took what was to be in agreement with social impact for developmental evaluation support, and we basically repurposed it to create what was basically a learning evaluation focused specifically on the agency's COVID-19 response. So our purpose basically was to support organizational learning. It's just as Danny said, we're not focused on accountability here, we're focused on learning. Our objective was to provide timely, good enough evidence to inform decision makers in adapting UNICEF's approach to its response. And then finally, our audience. We were really targeting UNICEF staff at HQ and regional levels who held responsibilities for leading and managing the COVID-19 response. And in particular, this included an HQ coordination structure called the COVID-19 Secretariat. And that was actually the body to which the evaluators were embedded. And our secondary audience then also includes other UNICEF staff interested in lessons learned, and also with an interest in adaptive management, because basically I think that's what this is really all about, is supporting adaptive management. We're working on a relatively short timeline. We launched in May of last year, and we are looking to bring this activity to a close in February. So I'll just move on from there. So what was the process that we used? I'm not going to go into great detail here. I'm just going to provide an overview, and I'm not going to talk about the findings, which are really quite specific to UNICEF internally. But what we did in this process was basically, our first objective was to develop what we were calling a learning agenda. And we basically did that by a process through which we sourced and synthesized questions. So we had a number of interviews with key decision makers in UNICEF, really trying to elicit from them what was top of mind for them in regards to learning. What was it that they felt that they needed to know in order to move forward and be effective in the response? We also used a fly on the wall approach, which is basically, again, it's part of the embedded practice. It's basically having an evaluator, attending key strategic meetings on a regular and an ongoing basis, not as a participant, but really as an observer and a recorder. And so we did quite a bit of that. And as a result, we ended up with a very large number of questions. No shock there, over 400 questions that were, sourced. We did a little bit of bucketing into 27 higher order types of categories. And then basically we needed to take it back to our key decision makers. So basically what we did was we held first a workshop in which key decision makers basically considered these 27 buckets and talked among themselves as to what were real priorities, what really needed to, rise to the top of the list to be examined, because we had a very limited amount of time in order to do so. And we wanted to be very focused on what we were looking at. So we asked them to do that for us, and we emerged from that workshop with a priority of 4 priority question areas. And then we also did a brief poll, not unlike what we've just done here this morning with the Mentimeter. And then we reconvened that group basically to agree on what would be the final 3 questions that we would examine during our first round of evaluation. We have indeed structured this in rounds. So our first round launched in January. And by mid-August, we were already engaged in discussions about our key findings and feeding that information into decision-making processes. And I should just say that that was actually another very important step as we were looking at our questions. Was for each of the questions, we were really trying to drill down to understand what are the key decisions that this will inform, when will those key decisions be taken so that we could basically, you know, plan and accompany the process and provide them with this timely, good enough information. So we wrapped up our first round, and then we basically launched a second round. We didn't resource questions. We didn't go through the whole sourcing of questions process a second time. What we did was we took a set of priority issues that had emerged during round one, and basically, again, we vetted these with stakeholders, and now we've actually launched round two of the process. So that's where we are right now. We launched it in early October. We're in the midst of key informant interviews, and we'll be wrapping this entire project up by late February. So just to proceed from there, I thought it might be a little bit interesting for the group to talk a bit more about this question sourcing and the prioritization. One of the things that I'd like to say here, and it goes back to one of the points that Danny made earlier, which was about, you know, is your organization's culture ready for this? And I have to say that, you know, that is very, very important. I mean, I will say in all honesty, we really got our foot in the door to be able to do this in the manner that we did because we had basically, you know, our director of evaluation really advocating for us within the organization, introducing this. This was a very new way of working. People didn't know if this was going to work or whether it was going to be, you know, generate valuable information. And so we really needed to do a considerable amount of introduction and orientation and kind of, you know, building buy-in for the activity early on. So again, as I had just said, initially we sourced 400 questions. We used a variety of methods to do that. We grouped them into 27 categories. Again, had this discussion workshop with senior managers within HQ in order to get to what our priority questions were. And in a final go round, we made sure that those priority questions, as I just mentioned, were directly feeding into specific decision points. And again, a lot of that was pulled off because of, you know, there was a willingness to expend political capital basically to make this happen, because this is so unlike our traditional evaluations. And obviously it was unfolding in a rather unprecedented situation with the COVID outbreak. So that's all for me at the moment. I'm just going to end there and ask people if they have any questions or issues that they would like to raise, either directly or, you know, gladly respond to questions in the chat as well. But thank you so much for your time this morning.
Great, thank you, Beth and Danielle. So there's no question yet on the chat, so I don't know if people have any comments or questions, because if you're still thinking about your questions, we can also take on Yuen's presentation and then come back to maybe some of your comments and questions. I know usually in the first presentation, people are still thinking. So any questions or comments? And maybe I mean, you know, everybody sort of put in their comments on Mentimeter when Thomas sent through the question. Think about the things that you said on Mentimeter. How does that relate to what Danielle and Beth has just presented? Is there anything that you see that stands out for you?
I see one question here about budgeting.
Yeah.
And maybe I'll just quickly respond because we've actually done a lot of work on this. And so I think a couple of things. One is that in the slide with the resources, there is actually a draft kind of budget template and ways to think about budgeting, because we have iterated a lot internally as we've done developmental evaluations for different organizations. I would say it typically is more expensive. You are paying for somebody to be there, usually full time. And so it's not, you know, 3 weeks of data collection. It might be 5 months, a year of data collection and analysis. There often are most cost savings are when you're adapting a program so that it's, you know, you're not waiting till the end. So you're able to adapt and save money there. We like to see it as not thinking of developmental evaluation as purely evaluation. It's also project or program or process design and implementation as well as evaluation. but it is more expensive. You typically are going to budget for the embedded evaluator as well as some surge support. You don't necessarily know what additional data collection needs are going to arise. So you need kind of a bucket of funding that says, okay, if this evaluator doesn't have enough time to do a massive survey, or doesn't speak the language that's necessary to get additional data that comes up, or maybe they just don't have the skill. I mean, we've done evaluations where it became clear we needed social network analysis to address an incoming question. And so wanted to have people specializing in that jump in and help out. So I'd recommend taking a look at that resource as a starting point, and also feel free to reach out. And we've done a lot of work there, so feel free to ask questions, and I'm happy to respond. Maybe I'll turn it to Beth for the second question on the difference between developmental evaluation and rapid evaluations.
Sorry, Beth, can I just suggest that you respond to it on chat? I see Salilo say that it's already given him some answers to his question. Yeah,
exactly. Yes.
Yeah.
Okay. Thank you.
Awesome. Okay, so thank you so much, Beth and Danielle. And if our next presenters can do as well as Beth and Danielle did, sticking to the time that's allocated, that was fantastic. Thank you so much for that. And I think that's quite useful. And so we're going to move now to Dr. Uyen Kim's presentation. Uyen leads the Innovation, Learning and Uptake unit in the Office of Evaluation at UNICEF HQ. And Uyen is going to talk to us about time series source data for rapid assessments for behavior change. And that's going to really link really nicely to what Beth and Danielle just presented now. So Uyen, over to you.
Thank you, everyone. And do I have control of the slides?
Yes, can you click in the Zoom window?
Let's see. Yes. Okay. Thank you, everyone. And I'm happy to discuss with you my initiative that I embarked on during the pandemic, where I took a concept that was linked to social data. I initiated a time series, real-time community-based data using mobile telephony. As you remember, when the pandemic struck, there are many of us in lockdown, working from home, and communities are also in lockdown. So there was limited mobility, and this provided a ripe opportunity to exploit mobile phones to collect data. So in my presentation, let me just indulge me a little bit, because I do, real-time data has a very interesting elements and variables to examine, and I'm going to present a few and try not to get too stuck in the weeds of the findings, but these were already presented and are made available, so these can be shared if needed. This is my outline of my presentation. I won't spend too much time going into this, but let's go to slide 3. Really, the global pandemic really provided, it really upended the world in so many levels. And to understand the virus's impact, we've seen a surge in mobile phone data collection. It was already happening pre-COVID, but it's particularly got a boost during COVID. Especially when community health workers and our partners were locked down. And in such emergencies, timely, high quality information about people's well-being, service delivery, income, health, and among many other topics were not readily available in some parts of the world. In this presentation, I'll focus on 3 countries in East and Southern Africa. And one of the reasons why I thought this was an important initiative is that we needed population data. We wanted to understand how people were coping, what impacts they were feeling from people themselves, reporting what is happening in a rapidly changing disease landscape. While administrative systems were down in a lot of countries, we couldn't rely on district level data or subnational level systems. And so using real-time data seemed to be the appropriate frequency for us to understand how quickly this pandemic was evolving and upending people's lives. These arrows are a little bit hard. Oops, that's what I was supposed to do. We anchored the the study in a behavioral drivers model, which is a well-conceptualized model that was used and published from our UNICEF colleagues from the Community for Development. And essentially, as you can see, it's quite complex, but still very much familiar. If you're familiar with CAP studies, this is reflective of CAP studies. And what we did was we developed very short mini modules, like 7 to 9 questions, 10 questions maybe per module, and and according to each of the pathways, so that we could study the hypothesis and the pathways, the drivers that led to specific outcomes. In total, the mobile phone survey was no more than 24 questions, because if you have ever gotten a phone survey, after about 20 minutes, which is about the average time it took for people to kind of go through the complete the survey, you get kind of tired, and then the response rate drops off, and then fatigue, biases, and other things sets in. Okay, here are the countries where we've been working, and these are, sorry for the wordiness, but you don't need to worry about that. We're kind of looking at countries where there was a real vacuum of data. So these countries were selected on a demand-driven level, meaning that, as you know, many countries were doing all kinds of surveys, and we wanted to reach out to in our region of the 20-something countries, look at those who really didn't have any data that they could use, real-time data. I think that sets this study apart is that we used weight models, and we sampled, well, let me get to that later, but these data have been weighted using base weights, and using census data to ensure that we are trying to be as representative as possible in the geographic area where we enumerated the data. Okay. Yes, in terms of our methodology, it was quantitative data, structured data, because it's mobile phones, so they had answer options. It was repeated cross-sectional. We decided against using panel data because panel data, as you know, always has some level of attrition, and we wanted 3 time points. And the 3 time points was, we felt, the minimum for us to understand the evolving behaviors that were occurring during a period of a pandemic. So strategically, we collected data during a lockdown. We collected data when schools were reopening, when economies were reopening, to see how certain public or economic policies shape or influence people's behaviors. And we planned these rounds of data between 1 and 2 months. And that is because there's no point in collecting real-time data unless you can quickly do analysis and feed back to the countries in that time that you're collecting data. It's very easy to collect data. It's very hard to clean and process data and produce a full deck of visualizations and interpret that in a way that program designers and policy designers can make sense of. For most of the countries, we use national and subnational data, and then we used 4 demographic variables because we really wanted to keep this as lean as possible. Apologies for some of the Ethiopia stuff that got in here because it just landed into my data warehouse the other day, and so some of this is a little bit of Ethiopia. But in general, our analytic approach is that because when you design a survey, of course, around a conceptual model, you have the ability to test hypotheses, not just going way beyond descriptive analysis, but you can also test hypotheses, and then you can build regression models to look at inferences. Which profiles of certain people are exhibiting certain barriers to seeking help, or what are the profiles of parents who are not willing to send their children back to school? What are the differences between rural and urban? Who are the most sort of actual influencers on the ground in rural areas versus urban areas? We saw some remarkable differences in some of these variables, and so our analytic approach really was kind of trifurcated, can you say, not bifurcated, but we tried to move beyond descriptive analysis of just proportional reporting. In this in some of the slides I'll show you, I will not be able to talk about inferential findings because that's probably too detailed for this type of evaluation, but we did go at the country level with each of the program managers to interpret this data according to what we were finding in the analysis. The primary questions that the mobile phone, this community rapid assessment, quite generic name, but I'm not a creative person, so I use community rapid assessment, is to fully test whether the behavioral drivers model, the one that we use to kind of develop our community engagement strategy at UNICEF, really holds water, right? I mean, we always want to know whether or not our strategies that are pegged to a framework is really working. And the questions that we use, the primary and secondary questions, there are 5. How are behaviors changing over time and why? How are communities coping with the disruptions related to COVID-19? What are the emerging needs of the community now and during a recovery period? And to what extent are people's behaviors affected by their levels of trust? Finally, and I don't think I'm able to answer this in this presentation, but certainly UNICEF, C4D, and evaluation colleagues can. How can UNICEF adapt its programming to better address the issue of relevance based on community source data? The one thing I will say is that this data set is a very small study. We spent on average $21,000 inclusive for each country. That's 3 rounds of data, because mobile phone, airtime, market rates in Eastern Southern Africa are quite competitive. So we're lucky in that sense. But for countries that couldn't afford it, I mean, it could be upwards of $50,000 per country for, you know, a full kind of study as the one I'm showing. Let me just get to the early findings quickly. And if you'll excuse me, I just want to make sure I have the right notes. We focus on selected findings only here. I mean, each country had a full visualized slide deck, and we did test hypotheses, but again, I'll just show you some selected ones. The demographics here are, sorry, am I on the right here? Yeah, it's just to show you the quick distribution of the demographic covariates. And surprisingly, more women answered the phone than men did in all 3 countries. In Ethiopia, we found that women did not answer the phones, and that actually there was a bias of men answering the phones and having phone subscriptions. So getting a gender balance in some countries was quite challenging. And for age distribution, you can see it's evenly distributed across the countries. Let me go on to the next slide. One of the pillars of what we're doing and what the organization is doing in C4D is measuring risk perception. And risk perception is high for the majority of respondents across countries. However, there's a visible segment that perceives risk to be low. This is not the case in South Sudan, if you can see. And when you ask the question in Kenya, we didn't really ask the question in risk perception in Kenya, and there was a reason for that. I think they already had this kind of risk survey done, so we used the already available data on risk in Kenya. But you see in Kenya, although risk was not directly asked, we see that the issues that that concern most families are children getting sick with COVID. You know, when looking at protective behaviors in South Sudan, the majority of practices have high levels of self-reported compliance, with the exception of mask ownership. I think most people, when you do a self-report on are you wearing a mask, or how many times have you worn a mask when in public, most people will self-report a bias of preference, right? So they want to, it's like when your doctor asks you how many units of alcohol do you drink in a day. That self-report sometimes has a bias. So we asked 2 questions. In your community, how often do you see people wearing a mask? And expectedly, we saw a bit of a discrepancy. This indicates that most people have an intention to protect themselves, or they want to protect themselves, but for some reason or another, there are certain barriers that we try to identify. Okay, so this slide, let me just say a few points here, is that in the 3 countries measured, Kenya seems to be the most compliant with protective behaviors. There are slight differences in the profiles of respondents. There's not so much difference in male rural to urban and male to female, very slight. But we're now conducting some hypothesis testing and developing correlation matrices where it could help us better identify profiles in areas where C4D program can be better tailored. And one of the components of the community rapid assessment is coping. How are people doing during the pandemic? And we look specifically at how are they doing with the school closures. And we see that in terms of assessing parents' willingness to send their children back to school, in Kenya, there's a very high willingness, so that there's a certain, alluding to an element of trust and needing the school to be an essential function of society in which they felt they were able to send their children back to school. But in South Sudan, you see in certain demographics, and we highlighted this because it's a majority of children that are not attending school, not with radio distance learning, even though we saw that the coverage of radio distance learning programs seems to be high according to UNHCR data. We see in our data when we enumerated that actually most of those children are not accessing distance learning programs. In urban settings, expectedly, those that have televisions and radios, we see that they are to some degree learning on TV, not as quite as we would like, less than half, and then on radio even less. Another key area where these data can provide is regard to the uptake of essential services during COVID. And this is important to help better understand potential relationships between behavioral drivers and other protective behaviors related to healthcare and education. For the most part, I think in Kenya and Madagascar, people continue to visit health centers to seek healthcare services. However, at least 1 out of every 10 respondents were not seeking or accessing healthcare during COVID. We cannot draw really causation to this, but we did want to see, and because this is time series, we're looking at the trends of people accessing healthcare during a pandemic. We looked at those communities that are not accessing healthcare, and we looked at some of the barriers for this. As you can imagine, access to primary healthcare services, especially in rural areas and in several countries in the region, the same barriers persist, which is financial resources, distance, mainly those, right? So during COVID times, these are exacerbated. Much of the other data that we're looking at in the other 8 countries also reflect this and validate that the pre-COVID barriers of healthcare access remain the same. If there is any time in countries to really incentivize healthcare workers or doing conditional cash transfers for COVAX, I would say this is the time to do it, because we also saw, as we see, I hope in the next slide, it's not the next slide, but I'll show you. So 1 second. We looked at emerging needs. Yeah, there's in Kenya, it's very interesting. There's a sort of a sizable proportion of people who feel a high level of confidence in taking care of themselves. This is a very important indicator for behaviors because it reflects self-efficacy or one's confidence and belief that they can manage themselves, right? Or manage and cope with the disruptions that have been due to the pandemic. I think, okay. Misinformation is pervasive. It's even pervasive in first world countries. So we looked at where people are getting most of their information to try to pinpoint where we can sort of tailor an intervention to mitigate any misinformation. And we see that in Madagascar, the president has quite a lot of power and influence over nationally subsidized radio channels, whereas in countries like South Sudan, it's quite say ground level, I guess, door-to-door campaigning, community mobilizers, megaphone announcements, not necessarily a wide reach, but it looks like most people are relying on those sources of information. I don't have the slide for Kenya here because I didn't want to overwhelm you, but in Kenya, very interestingly, in rural settings, we have always thought that traditional leaders and religious leaders have been the primary and most trusted source of information. And we're seeing in our data that actually youth groups are becoming a more influential and trusted source of information, especially among that age cohort. And they're spreading information at a much faster rate than religious leaders and other sort of traditional, more conventional sources of information. Please say I have the trust. Yes, okay. The trust. This is so, for us, was very fascinating to look at. And again, I just want to underscore that in this slide, over the 8 countries, most people trust their healthcare workers. And this points to my earlier slide where, the access to healthcare is still a major challenge for lots of people and for certain pockets of the population and certain vulnerable groups, as we all know. If trust is very high among healthcare workers and access is a barrier for distributing information and distributing vaccines, this this still should be among the top priorities in my view of intervention. I think this is my last slide. Let me say that a mobile phone is not the same as a household survey. Household surveys are very extensive. I've been measuring poverty for 10 years in Africa and using household surveys and RCTs, and it's you can get a lot of information by staying in a household for a few hours, and you can talk to children without complicated consent processes. We were not able to talk to children in our study. We focused mainly on adults because adults can provide phone consents. The limitation of this, of course, is this is done through interactive voice radio to sort of mitigate the literacy issue. But the limitation of this is a mobile phone penetration. So we try to the best extent possible weight the sample so that it can be as more representative, even despite having this bias of mobile phone ownership. I think this is a cost-effective way to collect data and collect data from populations, from communities, because that's like our bread and butter. We want to know what they're thinking, feeling, how they're comporting themselves, what kind of issues they're having, and we want this data to be as representative of the population so that there's credibility behind what we say. I think this mobile phone data set is just one of several types of data that should be used. The adaptive management that Beth and Danielle presented earlier is a fascinating way to look at how programs are learning. This population data should serve as a data source to increase internal validity of our data. And in real-time data, as Jane will talk to, I think it's these data that actually trigger more responses than waiting for a long evaluation to be completed and then being presented. I won't go through all of these details, but I will say that I think mobile phones are here to stay. I think they're more important than our computers. I think the penetration of mobile phones will always increase. I think digital data sources will eventually, and if they haven't already, replace paper-based and tablet-based ways of collecting data. And I think quick surveys are can provide as valuable information in some cases than very long surveys in which a lot of data is collected, but I'm not sure how much of it is being used to really reshape or sharpen any kind of strategy. That's all I'll say. Thank you very much for listening, and I'll take questions and comments, reactions. Thank you.
Okay, thank you so much, Yuen. So I don't see questions. There's just a comment from Arnold, and there's probably a question from me. So if you want to respond to those two, and then while you're doing that, we can get Biko and Carlotta and Jane getting ready for their presentation.
I could address the sampling question. Thank you for asking that, because sampling is something I really love to do. To the extent possible, we use the WHO 30x7 cluster sampling approach because it's widely used and people don't usually dispute it. The phone company that we outsource this to, right? So each of the data route, so the average was $21,000 per country, right? And that's divided by 3, and they have a lot of contracts with mobile phone networks, and so they have this massive database that UNICEF just doesn't have, right? If we have that database, then we can sample, and then we can randomize again and randomize again. So they did a simple random sample, and then we did some stratification by the regions and the age groups once we were able to get the first sort of initial simple sampling frame. I think, yeah, and of course we did some, post stratification weighting on that sample. We just determined 1,000 would be a good number. We also wanted to keep this cost effective because I wanted to show that you don't have to spend a lot of money to capture population survey data, and you don't have to wait a long time to get some basic information. I think when we test the hypothesis and build regression models, now that we have the base weights, that's going to be the most helpful for program people. And now, there's economies of scale. Once you do this one time, you do this in many countries. We're just running our scripts across the 8 countries, and the hardest part is interpreting the data in plain language for program people to understand the so what, right? Since I'm not a community engagement person, I don't really know, but I can surmise that some of these things point to obvious low-hanging fruit for program people. And all of these data is, I tried to make it as open and access as possible, so people should be able to replicate the study. They should kind of dig into the data if they want to a little bit more. I think transparency is an important thing. We partner with Harvard Humanitarian Initiative, who reviewed all of our scripts, reran our data, helped us design our surveys. We use published surveys as much as possible. So, wording of surveys can be very tricky. If you don't use published surveys, you can get into a lot of biases. So we had an academic partner as a kind of peer reviewer. Thank you very much. Let me mute myself now, but thanks again.
Thank you so much, Yuen. I think that was that's great. I'm sure people are really thinking about the example that you just shared now. So what we're going to do now is move to our last presentation, which will sort of tie everything together and help us conclude, and then get into an open discussion and some further questions which you can raise even with the previous speaker. So we're going to go to the next presentation, which will be done by Bikul, Carlotta, and Jane Mwangi. And they're going to look at real-time assessment, which is an issue which I think most of us have had to either support or help with now during COVID response, as we try to help our governments to respond to an emergent global pandemic. So over to you, Jane and Bikul.
I will start. Carlotta here.
Yeah, thank you very much, Matotsi. Yes, we are going to present the real-time assessment. It's an assessment that was designed after a lot of consultation with all our regional offices and with HQ colleagues to really understand how UNICEF is responding to the COVID. How are we responding in all the different countries? So essentially, this is an assessment that has been designed globally, but has been customized by all the UNICEF regions, which are 7. And we are going to present a global assessment, really just giving, the top layer of how the design looked like. And then our colleague from SRO, the regional office of Eastern and Southern Africa, is then going to provide a bit more details in terms of how they've taken that and customized it further. So my colleague Carlotta will start, after which Bikul will come in with the specificities of the the Eastern and Southern Africa case study. Over to you, Carlotta. Thank you very much.
Thank you, and hello, everyone. It's good to be online with all of you today. As Jane mentioned, I'm going to briefly introduce the RTA, the real-time assessment, how it came about, and sort of provide you with a quick overview of the role that the evaluation office at headquarters had in this. And then I'll pass it over to my colleague Bikul, who will provide an overview of how the RTA was operationalized in the context of Eastern and Southern Africa. So why a real-time assessment during the pandemic? Earlier on this year, when we quickly realized that the containment and the mitigation measures for COVID-19 were hindering business as usual, there was at UNICEF some level of concern over potential blind spots that were being caused by the unusual remote working modalities and the rather fluid and ever-changing operating context. So UNICEF was asking itself, how are UNICEF country offices actually responding to the pandemic? How is quality of the response that we're providing being affected, if at all? For instance, there were queries related to the possibility of undelivered supplies or supplies being stuck in warehouses. So the idea of an RTA, a real-time assessment, came about, and it was really conceived as an exercise that would support the UNICEF regional offices in their oversight role, informing both regional offices and country offices in learning and in decision-making as the response to COVID was unfolding. So this exercise was really seen in having a value added, in it being informed by both internal and external streams of evidence. So not only by the internal monitoring data that the UNICEF collects and builds upon, but also in reaching out to government, implementing partners, affected communities, and so forth. And so this exercise was really designed and conceived as a forward-looking reflection on the ways in which UNICEF country offices were adapting during COVID, gauging issues related to implementation of the response, quality issues, and also really to try to distill challenges the country offices were facing, opportunities and lessons that could be applied both to the ongoing response and also future similar emergencies. So this RTA was planned to be a global exercise rolled out across 7 regions where UNICEF operates. Because of this, it was really seen as a great opportunity to create cross-country learning and cross-regional learning as well, and inform the preparation of UNICEF's humanitarian appeals, which we called HAC, work plans for 2021, and any other strategic moment of reflection, such as the regional and the global management team meetings that have been happening. So on this slide, I'm just giving you an overview of the 4 overarching questions that were driving the RTA. You can see there's a first question that revolves around issues of implementation and quality of the response. A second question on adaptation, so how well country offices were adapting to the needs of the population. A third question on early lessons that were emerging from the implementation, and a fourth one on related to what more can we do and what can we do and should do differently. So what role did we as UNICEF Evaluation Office at headquarters have in this exercise? Well, we engaged and systematically and regularly with key stakeholders and users of this exercise to ensure that it was relevant and useful. And foremost, of course, it meant making sure that the questions that were driving the exercise, the 4 questions that I presented on the earlier slide, on the previous slide, were the right questions to ask to drive the exercise. It also involved designing the framework for the exercise. So on the basis of the 4 overarching questions, identify the more specific themes that we were going to look at, and unpack the overarching questions into smaller questions and come up with a core set of questions and tools that regions would in turn use to customize as relevant in their own context. And this is a very important point that I want to make, because the RTA was really conceived as the global exercise, but with the regional offices in the driving seat. So the role that the evaluation office at HQ had was really to provide a structure, a backbone, sort of a common denominator for regions then to adapt and customize as they wanted. So it was up to regions to decide, for instance, in which countries to roll out the RTA, in how many countries, and so forth. And also on the extent to which they wanted to add questions and adapt the questions, the core questions that we were offering them as I said, a common denominator. So we provided a draft questionnaire for an online survey to be rolled out with UNICEF country offices, a set of core questions for key informant interviews with government, implementing partners, frontline workers, affected communities, UNICEF staff members involved in the response to COVID. And of course, we also wanted to ensure that regions would and countries involved in this exercise would harness the wealth of information that was and has been produced over the past months. Our role as headquarters was also to support some of the regions in administering the online survey that I mentioned above and conduct analysis on their behalf. We also recruited some teams of consultants for some of the regions to help them in the process. We also coordinated the ethics review approval process with an external firm that is based in DC called HML to ensure that the data collection process and the approach of the RTA was in line with ethics standards. And last but not least, we are producing a global synthesis report as we speak, consolidating the findings that are coming out from the regions. As I said, the RTA has been rolled out in the 7 UNICEF regions, and so far it covers 43 countries. So the idea with this global synthesis report is really to come up with trends, learning, and possible actions for ongoing and future responses. So That's it for my slides, and I'll pass it over to my colleague Bikul now, who will give you a sense of how the RTA was operationalized in Eastern and Southern Africa. Thank you.
Thank you, Carlota. Hi, colleagues. This is Bikul. Can you hear me loudly enough?
Yes, Bikul, can hear you loud and clear.
All right, great. So do I have access to switching the slides, or do I need to request someone? Because I'm not seeing anything on my screen.
I can try moving them on for you.
Oh, okay. All right. So yeah, so as Carlota mentioned, maybe if you can go back to the previous slide. Oh, okay. I see. Okay. Yeah. So. Okay. So yeah, so as Carlota mentioned, I'll be walking you through how we are operationalizing the real-time assessment in Eastern and Southern Africa. And the focus of my presentation really is to show you in a step-by-step way how we are doing this. So if you want to do this in your own area of work, you know, you have a practical sense. So before getting into the RTA, I just wanted to, for colleagues who are not familiar, who are not from UNICEF, I just wanted to show you what we in UNICEF understand as being the Eastern and Southern Africa region. As you can see, it is a vast, diverse region that stretches from the Red Sea in the north to the Cape of Good Hope in the south. Next slide, please. What you see here is a visual depiction of the COVID-19 situation in SR at the moment. There are more than, there are almost a million confirmed cases across the region, more than 20,000 deaths. Of course, South Africa continues to account for the highest number of cases in Africa. And it has 73% of total cases and 81% of deaths in the region. What you see on the left is a statement by our executive director, Henrietta Fore, as she says, children are the victims of the COVID-19 pandemic. Lockdowns and school closures are affecting their education, mental health, and access to basic health services. Of course, what this is, sorry if you can go back to the previous slide. Of course, this is particularly significant in the SR context, where poverty and demographics intersect with a large majority of the population comprised of children and youth. Next slide, please. And oops. Yeah. No. Previous. Okay. And what I have here is just a quick overview of UNICEF's ongoing response to the COVID-19 pandemic in the region. So as you can see, our response is mainly broken down by the programmatic aspect and the operational aspect. On the programmatic side of things, what's keeping us busy is helping governments contain and manage COVID-19 cases, supporting governments and countries with the mitigation of unintended consequences, and also helping prepare for worst case scenarios. Next slide, please. Okay, now we are on the RTA. So when we were conceptualizing the RTA for the region, we decided to go with the 4 questions that were proposed by the evaluation office. These were described by Carlota earlier. As you can see, each question has also been further subdivided. So for instance, the first question on adaptation has been subdivided into 4 sub-questions, the one on implementation into 9 sub-questions, and so on. Next slide, please. Next slide. Okay, yeah. So what you see here is a breakdown of the first overarching question of adaptation. So to be able to answer this question in a clear and comprehensive way, we looked at certain elements of adaptation. For instance, to what extent are UNICEF country offices in the region developing action plans and local solutions in response to emerging needs? To what extent are the country offices coordinating with government and other partners on COVID-19 response planning? Next slide, please. And what I have here is a simple mapping of the RTA questions and sub-questions against the standard OECD DAC humanitarian evaluations for humanitarian situations. So what you see here is that most of the OECD DAC criteria for humanitarian evaluations are covered within the RTA questions and sub-questions, which suggests that the RTA is quite comprehensive in its scope of inquiry. Next slide, please. And speaking about scope, what we are doing is we are conducting the RTA in 2 phases. The first phase is ongoing. It started in October and it will end in February 2021. And then the second phase is going to happen from February to July 2021. In each phase, the RTA consultants will review UNICEF's COVID-19 response across all 21 country offices with a special focus on 6 to 8 deep dive countries. And I'll get to these in a bit. From a thematic perspective, the RTA will cover all program, cross-cutting and operations areas, including health, nutrition, WASH, education, and so on. And this is one of the, I guess, major value adds of an RTA in a situation like this, because here we have an opportunity to look at UNICEF's response from a higher level, holistic, overall perspective. There is a lot of evidence generation activities happening in UNICEF with regard to COVID-19, but a lot of times they are sectoral. Another thing I want to mention is that the focus of the RTA is, in this instance, is going to be on the operationalization of the response rather than higher level results. So this is one way in which the RTA differs from your regular evaluation. And lastly, in addition to generating country level findings, of course, the RTA will identify regional trends. Next slide, please. Okay, so this is the timeline. As I mentioned earlier, the RTA will have 2 phases, and what we will do in each phase is we will collect data and produce findings and lessons with country offices and the regional office so that they can use this information to improve their response and performance on an ongoing basis. So this is what makes the RTA real time, right? Next slide, please. As I mentioned earlier, again, the RTA is going to cover all 21 UNICEF country offices in the region. But there will be some country offices that we are identifying as deep dives. These are country offices where we are going to collect more information and provide more individualized findings and recommendations. For the first phase, we have selected Kenya, Madagascar, Namibia, Somalia, South Africa, and Uganda as the deep dive countries. Next slide, please. Okay, so sorry, just one second. So what you see here are the different data collection efforts that we are pursuing with regard to the RTA. These are all relatively straightforward. The first effort is online surveys. We are going to gather online data from UNICEF country offices as well as external partners in the region, perhaps maybe 60 to 100 external partners in the region. We are also mounting a huge secondary document review and analysis effort. And then we have the deep dives in the case study countries. Next slide, please. Now I'll just briefly describe each of these data collection efforts in more detail so that you have a better understanding. So with regard to the online surveys with UNICEF country offices, what we are doing is in each phase, we are asking UNICEF country management teams in each of the SR countries to complete these surveys. An important point to note here is that each country office is completing the survey in a consultative manner. So it's not an individual who is providing these responses. These surveys are also quite comprehensive. So for example, in the first phase, we had each survey questionnaire include 28 questions. And finally, of course, what we have to realize is that whatever information that's coming out of these surveys is ultimately a self-perception. It's our own perception of how we are doing. Next slide, please. Then we are also, of course, speaking with external partners. So in each country across the region, we are collecting primary data from 3 to 5 external partners. This could be government partners, counterparts. This could be INGO partners, UN agency partners, and so on. As we all recognize, the COVID-19 response in all countries are very much a coordinated effort with different stakeholders working together. And collecting this information through external partners helps us get their view on how that overall coordination is working, but it also helps us triangulate our own self-perception that we have of our performance. Next slide, please. Sorry, Matutsi, just to take a break, but yeah, I won't be able to wrap up in a minute. So yeah, so the on the secondary information that we are collecting, in the first phase, we have collected and reviewed more than 500 documents, and these were documents on UNICEF guidance, presentation slides from SR reps, meetings and webinars, epidemiological data, including projections, information on socioeconomic impact, preparedness procedures, regional dashboards, data on results and funding and supply, and so on. And what we are doing is, of course, we are reviewing all of this information and categorizing them according to the different assessment metrics and questions. Next slide, please. And then finally, we have the key informant interviews that I mentioned earlier. What we're doing is interviewing 10 to 14 key stakeholders in each of the deep dive countries. This could be UNICEF country office leads, frontline workers, government, and other partners. Next slide, please. Okay, so what you see here is a matrix of the RTA, especially for the quality part of the RTA. And on the left, you see the RTA questions and sub-questions, and on the right, you see the indicators we're using to answer each of the questions, the data sources, and so on. The reason I put this here is because this is very similar to an evaluation matrix that we would use for our normal evaluations or our regular evaluations, and in that way, I guess the RTA is very similar with your regular evaluation. Next slide. Yeah, so moving on to the analytical approach that we will use in order to generate findings and recommendations from this RTA. The principle is, the approach is very straightforward. At the end of the day, we are going to rely on triangulation. We are going to triangulate the information coming out of these different data streams that I described earlier to answer each of the questions and sub-questions. But in addition to that, what we also plan to do is to assign a rating to the performance of each country office across the different key dimensions of response, such as adaptation, quality, and implementation. So, for example, if a country office gets a green rating on their performance, it means that they surpassed expectations. The country office did exceedingly well in relation to the specific question. If the country office gets a red rating on a certain aspect of their performance, it means that they did not meet expectations. And what this does is it really helps concretize the feedback and not just talk at higher levels and be fluffy and give concrete feedback. Of course, we will also aggregate the findings across the countries and provide regional ratings of performance across the different key elements. Moving on, next slide, please. Of course, the RTA has limitations. We are relying heavily on remote interviewing as part of our data collection effort, which means that there is an added distance between the respondent and interviewer, which can lead in the loss of a lot of contextual information. The other limitation is that the assessment does not cover interviews with final beneficiaries, which means that the assessment will potentially not have conclusive evidence regarding the impact and coverage of COVID-19 response. And this goes back to the point I was making earlier on about how this RTA is focused on the operationalization of the results rather than higher level results. Next slide, please. In terms of the key deliverables, for the first phase, at least, we are expecting to see individual analysis reports for each of the deep dive country offices. We expect to have a regional analysis report, and we will also have regional presentations of findings and animation videos to help with dissemination of findings and lessons across the region, both internally and externally. Next slide, please. Of course, the RTA is a huge coordination effort with 21 countries involved, and a lot of stakeholders have come together to make this happen. In terms of the oversight and leadership, we have the steering committee, which is based at the regional office. So the steering committee is providing the oversight. We also have a reference group, which is quality assuring the whole process. The reference group is comprised of colleagues in the country offices as well as the regional office. The overall effort is being managed by the evaluation section at the regional office. So if you have any questions about this RTA, you know who to contact. At the field level, we are being supported heavily by our country focal points, who are really mobilizing our partners and so on to make the data collection happen. And finally, the RTA is being conducted by Oxford Policy Management, with whom you may be familiar. Next slide, please. Okay, so so these lessons, and so I was thinking of sharing some lessons and suggested action points, but seeing that we are running out of time and the fact that these are quite internal to UNICEF, I'll skip on these. But if you have any questions about the RTA in Eastern and Southern Africa, I'm happy to answer them here, or you can drop me an email. Thank you.
Thank you so much, Biko. So, I mean, we have a bit of time to take some questions, and I think what we can do is to take questions not just to Biko's presentation, but also to the all the three presentations that we have had. So any comments, questions, or even observations? There were a few people when we did the poll who said that they have done their own sort of real-time assessments or have had experience with sort of rapid tools. It'll be great to also hear your reflections, having seen the work that UNICEF presented, how does that compare to what you've done before? Anything that stands out or that's, for you in the presentations that we had today. So any comments? When it's quiet, I'm going to become a teacher. Like I saw Eleanor. Is she gone? And I want to pick on Eleanor.
I can answer a question that I see in the chat.
Go ahead, Rian.
Okay, a question being asked is how the study was used by governments and CSOs or UNICEF country offices. That's a very excellent question, because in designing the study, we wanted to ensure that from the beginning, the heart, you know, the work that we do yielded findings that would be actionable and relevant to the country. So I can share with you what the country offices have done, but they have like realigned their RCCE strategy, their risk communication community engagement strategy. They have in Kenya, I think they have redesigned their national survey around COVID using some of the questions that we used from various guidances, including Oxfam, WHO. I don't know about CSOs, but there has been community feedback mechanisms that took place in South Sudan, which is also very interesting because we were, as I had mentioned, real-time data is not helpful unless the real-time analysis is coupled with that, right? So in South Sudan, because they have sort of organized themselves, the CSOs organized themselves, they were able to provide information like 87% of people are not wearing masks in your community. And this underpins a lot of the behavioral data that behavioral theories that we have learned, which is that knowing what other people do influences what you do. An example is, you know, you see at UNICEF House, 67% of people recycle their aluminum cans. That is something that's called a nudge theory and helps influences how other people do that. So those are sort of three mini examples, but I think they're doing this in country offices, but I'm not privy to that, but we do have a follow-up webinar at the end line of this exercise to look at use and uptake. Thank you for that very good question. Over.
And maybe, Uyan, it might be good if there's somebody from the country office who has more to add to that, or to also hear from Beth and Danielle in terms of how this kind of data collection, you know, is linked up to sort of adaptive management when you're dealing with emergent situations. Because I could imagine that a number of evaluators are being called on to help respond or to help inform responses from government. So maybe some of your reflection on that based on the work that you've done, because I've seen that you've also done work with not just with COVID, but also you've done work with Ebola. So you've done work with a number of sort of emergent situations where the government need urgent information and to respond quite quickly. So Beth, you're muted, Beth.
Apologies, sorry for that. So, I mean, one of the things that I just wanted to make was I really feel that a lot of the focus on real-time learning at the moment is almost a result of some of our prior experiences with public health emergencies like Ebola, in which, you know, attempting to do sort of a, you know, after the fact retrospective evaluation really was, you know, insufficient to the task of trying to capture all of the nuances of the situation and the actors. And so, you know, that's one of the things I think that's really led us to real time is, you know, that some of those prior experiences and how the methods available are attuned to and better tailored to decision-making, real-time decision-making. So one of the ways that we did that, of course, obviously, you know, we started our effort back in May. So it was really very, very early days. We were all still under lockdown in New York City. And so we were focused very much on basically HQ and what HQ's response looked like and how that could be improved. And one of the things that we were able to do was, you know, from back in, you know, May, June was to project about what key decision points were going to be upcoming. So for example, in early September, there was a very key decision making. In mid-October, another very key point, a decision point as to what the, you know, what the level of our response would be, whether it would continue to be an L3 or not. So those were some of the ways in which we really tried to see that our work was integrated into decision making. The other thing that we were able to do was, you know, in terms of this real-time learning and exchange, we had standing weekly meetings with senior managers in which we were able to bring back to them on a much more frequent and continuous basis, you know, what we were hearing, and, you know, by being a fly on the wall, or you know, perhaps having been exposed to some other information that key decision makers had not necessarily seen or heard yet. So that was also another really very important part of the way that we proceeded and tried to tie things in with decisions that we knew were coming up. Thank you.
And maybe I saw Alista and Alista, Furu, and Muriel. I mean, you're at the call phase working with the South African government right now, trying to respond to some of the emergency issues around COVID and children and other vulnerable groups. How have you been adapting and using evaluative evidence and other forms of data that is being collected either by UNICEF, but probably also by other partners, you know, just probably linking up to what Ian was talking to now. And I just also would like to hear from a colleague of mine from SAMEA, Eleanor, who is in the sort of education space, and even in the education space, there's been a lot of pressure to help schools reopen, how to keep kids safe. How have you been, you know, integrating this kind of tools, or what do you see as some challenges and benefits of using some of these tools? Maybe we can take those comments and then see how we take it. Muriel?
Okay, so first of all, thank you very much for this very informative session. I've been listening very carefully, taking notes, and in between thinking about our own real-time assessment. So South Africa is one of the 40-something countries that were mentioned earlier that are going to be the focus of this real-time assessment. And we are a case study. So we are actually in the process now of gathering all the information, lining up all the key informants that will be part of this real-time assessment. But parallel to this, we have also within the UN, we are continuously looking at how do we keep a pulse on what is going on? How do we keep our ears on the ground to really understand what is working, what is not working? And I can give a few examples. One being our water and sanitation response. As you probably know, in high-income countries or upper middle-income countries, we don't typically do downstream work or implementation kind of work. So this emergency has forced us, it has pushed us to do a bit of service delivery, if nothing else, to demonstrate the importance of hand washing with soap. So in implementing this, we have had to keep our ears on the ground, looking at the technology that we use and how appropriate it is, and where necessary, adjusting the technology that we are using. And this is really based on very quick, very rapid, and maybe dirty ways of collecting information, but it works. It really works. So the technology you're using for hand washing stations, it has changed. We're now using a different approach. We have learned that liquid soap is not affordable. It's out of reach for your average rural school out there. So we are adapting. We are using bar soaps now that are hung on a piece of string. And we are just trying to be relevant, to be responsive, and to be, you know, effective in our response in a very dynamic and fast evolving situation. So there are examples, and even in education, we can think of examples where we've had to adapt our approach based on the feedback that we're getting. And I must say our team that is doing our risk communication has really been instrumental in keeping us connected to the community, getting us the feedback, which is helping the program people to also adapt the strategies that we're using. So in short, I would say we need to be comfortable with things that are not perfect. I know we are coming from a very strong culture of we want it to be very scientific, we want it to be representative, etc. But when you're dealing with an emergency of this magnitude and a fast evolving situation, I think we need to have a certain level of comfort with imperfection, and we learn as we go. Lastly, I would like to share that I've been in a similar situation when I was in the Caribbean, and we did a real-time assessment of the impact of hurricanes Emma and Maria. And I can tell you the information we got was not perfect, but it helped us to understand the situation, the impact, and to adapt. Over. Thank you again, Matodzi and colleagues.
Great. Eleanor, I don't know if you want to add something around how you're using the Eval COVID TIG and how evaluators are sort of engaging with the education sector in that. Eleanor?
Sure. Thank you, Matodzi, and hi, everyone. I was actually going to share a bit about my experiences working as an evaluator supporting education programs in South Africa. So there we have a number of, I work for Jet Education Services, and we do external evaluation as well as supporting our own programs that we implement and manage. So there were a number of data sources that we were able to draw on. There were some that the South African government led. There was a rapid national income dynamics panel survey that was conducted, as well as some research by the Department of Basic Education. We also, and I think this study by UNICEF would be very useful for us to be able to draw on too. Didn't actually know about it until now. We collected some of our own data, and there were challenges to do with around that. As Muriel mentioned, you have to just accept that it's not going to be perfect and just do the best as you can, and feedback information and data to your teams as quickly as you can so that they can adapt as they go. So we found that there was quite a lot of shifting towards virtual and remote engagement so that we could still support school principals, teachers and learners, even though schools were closed, and shifting some of the things that we had been planning to do to next year, and looking at changing some of the things that we would be doing next year in terms of the support needs to look different. There's a lot of learning lost. So how do we help learners and teachers and school principals catch up with that, and what could we do? There were a couple of modules, training and support modules developed for principals around managing a school remotely, and how to reopen again safely, because those were some of the concerns. Maybe in a positive way, it pushed us into using, thinking about new technologies and being more rapid and quick in our turnaround times, because we can be quite maybe slow, and it's useful for people to get program teams to get information as quickly as possible.
Great, thanks, Elena. And maybe just one last comment from Nompumelelo, and I think that's probably directed to Danielle and Beth, just to explain a little bit what the practicalities of being a fly on the wall, being that critical friend who's involved in the process. And so if you can just explain that a little bit, and then we can probably start wrapping up.
Okay, okay, a practical example, of the notion of being a fly on the wall, how has that worked in the approaches being spoken of this afternoon? Well, I'll give an example early on in the, this is going back now a couple of months, earlier on in the response. One of the things that we were doing is we were basically listening in to both what were ongoing regular technical calls, global technical calls on the response, as well as global, again, ongoing global discussions at a more strategic level. And so being a part of the discussions on the more strategic level, it really helped us, I think, to identify a set of questions and issues that would not necessarily have emerged if we were, really focused on, key informant interviews, because the discussion was unfolding in a more natural environment, in a discussion of colleagues, of peers, senior peers, And so there were basically insights being provided there that I don't know that we would have otherwise been able to capture. And I mean, I think the other thing is that there's a certain consistency to it. I mean, we're always the same evaluators. We're always on the call. We never intervene. And so there's a degree at this point now, I would say, you know, of trust being built. You know, no one is hesitant to say anything because we're on the line. So yeah, I mean, I guess I would just give that as one very quick example. Thank you. Over.
Okay, so I think we've reached sort of the time we allocated for this session, and maybe just before we close, if we could hear if Jane, Bicol, and Coletta, you have last words, and then we can wrap up. And I just sent a message. There's a request that we take a photo, a group photo. So if you just get ready, if you need to fix your hair, just ask you to switch on your camera for the photo. Okay, so let's hear maybe from Jane and Bicol, your last words.
Bicol, do you want to go first? And then Carlotta?
Yeah, thank you so much, Matutsi. I think it has been very interesting sharing this real-time assessment experience that we are going through with all of you. I guess the one thing I would like to highlight is that don't get intimidated by the word real-time. It is, in many ways, it is very similar to a standard evaluation, and yeah, it's relatively straightforward and easy to do. And you know, if there is an opportunity to do this in our respective roles, we should also always strive to do so. Thank you.
Carlotta?
Yeah, maybe just quickly to say that with me personally, what Muriel said really resonated, like the idea of being comfortable with imperfection. In the case of the RTA, I think striking the balance between depth and timeliness of the exercise is really something that, you know, you have to become comfortable with. So yeah, that was I think a great point, and accept the good enough. In the humanitarian world, we talk a lot about good enough information, and I think in these cases it is extremely relevant as well. Over.
Thank you very much, Matotsi, and colleagues who have joined this call. I also want to thank our South African country office, also just for reaching out to us, and also for the regional office. For us, we wanted to present you with the ways that UNICEF is adapting in recognizing that we need to make fast decisions, and we are very interested in ensuring that we can make decisions based on evidence. So as colleagues have said, including Muriel, Carlotta, Uyen, Beth, it is the element of how can we gather data in a rapid manner to help decision making. So the three examples we presented today are among the many others that UNICEF is working on to kind of just like ensure that we are making decisions based on evidence. So we are very glad that you gave us an opportunity to present today. And of course, we'll be sharing the presentations. And if anybody has any particular questions, they can always reach back to us, and we'll be able to provide as much information as possible. But otherwise, just to say thank you very much, Matotsi, for hosting us today during this session. And thank you very much, colleagues, for participating. Yeah.
Thank you so much. So thank you so much to UNICEF. I think from SAMEA's side, we really value the partnership with UNICEF, because it also helps us with that bridge between the sort of monitoring and evaluation side and the policy work, which is quite a critical issue, because otherwise if we're doing M&E and is not necessarily being relevant or responsive to policy issues, we're doing it for naught. And so this relationship is really critical for us as an association, and we're really looking forward to continue with it. And I think on a sort of work side, I think this question is an important question, because I think as countries are facing the pressure to respond, and there's so much misinformation that people are having access to is really critical for evaluators to step up with credible information, but timely, and in a way that people can access it, in a way that decision makers can use it. And I think this is why we thought this session was important for our members to participate in, and to sort of see how can we make information, credible information, relevant and accessible to decision makers at this time. So on that note, over to Thomas to take the photo for us, and then we will let everybody go. Thomas?
Yeah, sure. Everybody cheese in 3, 2, 1. Okay, one more time. 3, 2, 1. Thank you very much.
Thank you so much, everyone. And thank you to all our presenters for your fantastic presentations. And as for everyone who joined, remember that we will have all the materials on the SAMEA website. So you will be able to access all the information, all the presentations and the recording from today's session. So thank you very much for joining us and giving us 2 hours of your time, and hope you find the session useful and that you'll be able to use it in your work. Thank you very much, everyone, and bye-bye.
Thank you.
Thank you.
Bye.
Bye.
Bye-bye.
Bye-bye.